125. Senator Eldridge has an amendment which clerk will read.
Amendment number 125 by Mr. Eldridge and others, single-payer health care.
Senator from Middlesex and Worcester, Mr. Eldridge.
Thank you, Madam President. I ask when this amendment be voted on, by a call of the yeas and nays.
For us, and when a vote be taken, to be taken by a call of the yeas and nays. A sufficient number having risen, the yeas and nays will be ordered. The senator from Middlesex and Worcester, Mr. Eldridge.
Is a discussion about universal single-payer health care. Health care is a right. I have been a sponsor of the bill this past session. This amendment before us is not implementing single-payer health care. It's an amendment to study single-payer health care. It's a benchmark against our current health care system. And if that study is proven to be more cost-effective, highlighting the values behind universal health care, it would ask the state in FY 2015 to propose a plan for single-payer health care. I have worked very closely with the gentleman from Belmont on a redraft. This is not focused on implementation of single-payer health care, but an analysis, a benchmark of single-payer health care, and asking the states to submit a plan if it determines that single-payer health care is a more effective way for the state to go forward. What this amendment would do was instruct the state to estimate every year from now to FY 2015 what the state of Massachusetts would be saving under a single-payer plan that would guarantee publicly provided comprehensive health care for all residents in the state. And as proud as I am, Madam President, of the advances we have made in health care on this front, a leader in the nation, I do think we need to go further. And on the subject of health care cost control, I would argue that single-payer health care is not only good for providing better health care for all residents of Massachusetts, but it would also significantly reduce costs. I know we've all heard from our towns and cities, from our small businesses, from families, about the rising costs of health care. I would argue that the most successful, effective way we could reduce those costs while actually increasing the quality of care is single-payer health care. Now, why single-payer health care, and what is single-payer health care? Let me state the basic values stated in the amendment. It is guided by the following principles. Health care coverage must be universal. We have near universal health care coverage in this state, but not universal. Health care coverage must be continuous. One of the other bills that I filed as part of this discussion today is about continuity of mass health for poor families and their children. That speaks to the fact that right now there's a lot of families who fall through the cracks that go a little bit above income. And we know many, many families, whether those who are paying for health care through the Commonwealth Connector or getting it through their work, that can lose their health care very quickly through the loss of a job. Health care coverage must be affordable. I don't have to tell anyone in this room we have the most expensive health care in the country, and the United States has the most expensive health care in the world, with a number of outcomes that are not as good as some of our fellow first world country neighbors. Health care must be affordable and sustainable for the Commonwealth as a whole. How do we pay for it? Health care coverage must support patient-centered care, protecting the relationship between patients and their health care practitioners. So what is the problem with our current health care system? Why aren't we closer to the values I just stated? First of all, our health care is extraordinarily expensive. The United States spends more money per capita on health care than any other country in the world. We have no capacity to control costs. There is a comment by many of my colleagues here about how do we control costs and suggest that let the market reduce health care costs. I would submit that the way we control health care costs is to looking at more of a regulatory structure, stating that government has a role to play in the delivery of health care and how hospitals and doctors and nurses are paid for that. Health care is financially ruinous for many household, businesses, and government budgets. The #1 reason that families fall into bankruptcy in the United States and in Massachusetts is medical bankruptcy. And we all know from the debate just last year on municipal health insurance that health care is a budget buster for our towns and cities, pitting our public employees against our elected officials. And finally, sadly, our current health care system is highly discriminatory. Health care disparities, which the gentlelady from Lincoln has dedicated a great deal of her career to, are significant along lines of race, ethnicity, class, gender, and age, and unmatched in the developed world. So how do we reduce those costs and improve quality? Access to prevention and early intervention. I want to praise the presence of the Preventive Health Care Trust in this bill, but I think we need to go further. The model of universal single-payer health care gives everyone access to primary care without cost barriers. It reduces how many people get sick in the first place and allows us to catch illness and injury before it becomes serious and even more expensive to treat. Reducing insurance overhaul. Private health insurance companies spend from 10 to 30% of our health care dollars on overhead. Public insurance, Medicare, spends less than 5%. Single-payer plans don't need to advertise. They don't need to pay exorbitant health care salaries. They don't need to hire legions of people behind closed doors on billing. Bulk purchasing power. There are a number of senators here in this room, the gentleman from New Bedford, gentleman from Amherst, that have gone to great lengths to work on the discussion of bulk prescription drug coverage. I would argue that's only the first step in reducing costs, that if we have the power through bulk purchasing power through single-payer health care, we can significantly reduce our health care costs. This amendment is very similar to the approach that was adopted by our neighbor to the north, the state of Vermont. That legislation, which has been signed into law, called for a three-stage implementation of a publicly financed universal health care system. Now again, Vermont has not implemented universal single-payer health care system. They have set a path. And what I'm arguing today is before we can set that path, before we can have that discussion in the legislature, we need to have a benchmark based on the values of universal health care. That needs to be studied over the next several years. And if it is determined to be more cost-effective, to be truly universal, to be affordable to all of our families, that I'm asking the state to submit a plan to the legislature for consideration. Now, the issue of how do we pay for it is raised, and that would be part of the state's role as well, is how do we pay for universal single-payer health care system. Again, this amendment is studying the issue. It's creating a benchmark for universal single-payer health care. It's an opportunity over the next couple of years for us to look at this dynamic to see if this is in the best interest. Let me just finish and say that a number of health care advocates and people in the health care system have said to me time after time, especially after the past couple of years since we passed near universal health care in Massachusetts, that this state, that this country is moving towards single-payer health care. Well, that might be the case. Here is an opportunity to take an even bolder step towards single-payer health care. Let's take a look at the data. Let's take a look at the benchmark. Let's have a real conversation about squeezing out those costs, about expanding coverage, about creating a more equitable, universal health care system here in Massachusetts. We have been the leader in health care in this country with the law from 2006. I think the bill before us brings us further along and continues to show the leadership the Senate has shown on health care costs. But I think the biggest step we can take towards reducing health care costs is eventually having the discussion of single-payer health care. This amendment will get us that much closer to having a real, data-driven discussion. Thank you, Madam President.
Senator from the Cape and the Islands, Mr. Wolf.
Thank you very